What I do for Dental Health Associates is assistant to Dr. Walther. Specifically in our practice, while it's a general practice, we take care of a lot of special needs patients as well. So we do IV sedation, and we take some patients to Meriter Hospital as well. My favorite part and the hardest part about my job are the same, and that's taking care of people who maybe haven't been to the dentist in 15 or 20 years because they're terribly dental phobic. So they come to us, and we have a variety of options, and including IV sedation, so that we can take care of their needs and make them feel good about themselves. At East Clinic, there are 6 dentists and a periodontist and an orthodontist, and I like the way they all work hand in glove together. We each have our own team, so I work with my coworker Deb, and she's been there forever, literally forever. I think it's been the only job she's ever had is at Dental Health Associates. So she's grown up with the company, and then there's a hygienist, and it's a great. What I like best about DHA as an employee is I know they always have my back. So I can have something happen in my personal life, and I know that they'll support me so that I can do my job to the best of my ability. I worked for single practitioners before, and while it's been great, working in a group practice has been really a gift for me and for my family because, again, they have my back. So then I can have theirs. No one person can do everything. So it's nice to be able to have your particular skill to bring to the team, but there will be somebody who is really good at managing pre-auths, and they'll make sure that the patient understands that, so that there are never any surprises. So we all just work together. The hygienists do a great job. I like that there's several hygienists, so that if I have for example, one of those phobic patients, I can pair them with the right hygienist that fits their personality. In my spare time, I almost have another part-time job. I'm the president of Cambridge Arts Council. It's a nonprofit organization in Cambridge, which is where I live. I've always been really community involved all my life, so I don't know any other way. In Cambridge, we've struggled with economic development in the past 7 years since the recession. What we're doing is using the artists, and we're artist rich in Cambridge. 32 artists call it home. And those are just the ones that actually have a business. So we're using art as an economic tool for economic redevelopment in Cambridge. And so we can put ourselves back on the map like it was in the 90s when it was the row pottery craze. There's a lot of artists, a lot more than pottery there. So we work hard. Since I've been in Cambridge for 25 years, and my first involvement there was the London Bridges Preschool, small town just outside of Cambridge, small town. And it was a parent cooperative. And I learned to work side by side with these other parents towards a common goal. And those people still now are my lifelong friends, and so seeing the park filled, for example, during a concert, seeing the park filled with people that are enjoying it, they're picnicking, it's really amazing to see how community can be fostered that way.